I'm happy to introduce our first abstract presenter, Dr. Theodore Ruel from UCSF Benioff Children's Hospital, San Francisco in the US. He will be reporting 24-week safety, tolerability, and efficacy of Dolutegravir dispersible tablets in children 4 weeks to under 6 years of age with HIV, results from IMPAACT P1093.
My name is Theodore Ruel, and it's my pleasure today to present these results on behalf of the IMPAACT 1093 study team. I'll be presenting data about the 24-week safety, tolerability, and efficacy of the Dolutegravir dispersible tablets in children ages 4 weeks to less than 6 years of age with HIV. Dolutegravir is recommended for first-line treatment of adults and children with HIV due to its potency, high barrier to resistance, and tolerability. A 5 mg dispersible tablet pediatric formulation is being evaluated in IMPAACT P1093, an ongoing phase 1-2 open-label PK safety, efficacy, and dose-finding study. Today, I'll present our 24-week results among participants who received the dose proposed to regulatory authorities. I'll add that the FDA actually approved this formulation on June 18 of 2020, with a hyperlink to the label provided at the bottom of the slide. This slide summarizes our methods. Children were enrolled into 3 age cohorts, 4 weeks to 6 months, 6 months to 2 years, and 2 years to 6 years. Children had to have an HIV RNA of greater than 1,000 copies per ml at the time of enrollment. This could include treatment-naive or treatment-experienced children who were failing therapy. The dispersible tablets were 5 mg units and dosed by WHO weight bands, as shown in the table below. Children also received an optimized background regimen that included 2 other agents, of which one had to have genotype-predicted activity. Clinical and laboratory assessments occur between days 5 and 13, and then at weeks 4, 8, 12, 16, and 24 with 3-day visit windows. Safety data included in this analysis were current to April 30, 2019. Additional details about the protocol can be found at the IMPAACT website shown by the link below. This slide summarizes the characteristics of our study population, including 51 children. Of them, 55% were female. The majority were recruited from Africa, representing 70%, with an additional 12% from Thailand, 4% from the USA, and 14% from Brazil. 29% of the enrollees were ART naive, and the median RNA at the time of enrollment was 4.3 log copies per ml. The optimized background regimens are summarized in the table to the right. You can see that 47% received abacavir plus lamivudine, an additional 20% received zidovudine plus lamivudine, and a diversity of different regimens received by the other children, but worth noting that 13 of them received lopinavir ritonavir as part of the regimen, and 1 child received both efavirenz as well as darunavir ritonavir. This slide summarizes our virologic efficacy results. It was assessed in 34 or 67% of participants who had 24-week HIV RNA results available at the time of data freeze. In the figure, you can see the proportion of participants who achieved a viral load of less than 400 copies per ml at different time points in the 24-week period. The table on the right summarizes those at the 24-week time point. The first row represents those with viral loads of less than 400 copies per ml. 29 of 34 or 85% of participants achieved that endpoint. The second row summarizes those who achieved less than 50 copies per ml, and that included 18 of 34 or 53%. You'll note wide confidence intervals reflecting the small sample sizes of this population ultimately. We've also included for reference results from a similarly structured sailing trial in adults, which reported that 87% of comparable achieved a proportion at less than 400 copies. 79% achieved less than 50 copies at 24 weeks in that trial. This slide summarizes the virologic and immunologic outcomes of children receiving the dispersible tablet formulation of dolutegravir that's stratified by age cohort. So across the first row, you can see the 3 age cohorts defined with, again, 4 weeks to 6 months, and that was included 17 children. 9 children were 6 months to 2 years, and 8 children were 2 years to 6 years, smaller numbers. Across the first row, you can see the proportion that achieved HIV RNA of less than 50 copies per ml at 24 weeks. That proportion was 41% in our youngest cohort, 67% in the middle, and 63% in the oldest cohort. Across the second row, you can see the proportion who achieved less than 400 copies. In comparison, these were much more comparable across the age cohorts, with 88% in the youngest cohort, 89% in the middle cohort, and 75% in the oldest cohort. Across the bottom two rows, you can see changes in CD4 count and CD4%. Without going into details, you can see that most achieved some degree of recovery, but there were wide ranges in diversity among them, and in some cases even declines. These data were difficult to interpret when overlaid upon normal age expected changes across these time periods. Safety and tolerability is summarized in this slide. All children who received the proposed dose were included in safety analyses. No grade 3 or 4 adverse events were attributed to study drug, and accordingly study drug was never discontinued due to toxicity. The table below summarizes adverse events of any attribution, or overall, of grade 3 or greater severity. The first row summarizes clinical events, or participants who experienced clinical events. This included 13% of the youngest cohort, 17% of the middle age, and 6% of the oldest cohort. Laboratory events are summarized in the second row. 57% of the youngest cohort, 33% of the middle, and 19% of the oldest cohort experienced laboratory events. Laboratory events included anemia, neutropenia, and clinical events included common infectious diseases such as pneumonia, diarrheal illnesses that are unfortunately commonly experienced in the study population in our study settings and in greater incidence in the younger populations. Tolerability of the dispersible tablet formulation was excellent, with palatability rated as average, good, or very good for 98% of respondents. In summary, the dispersible tablet formulation of dolutegravir was well tolerated, had a favorable safety profile, and demonstrated virologic efficacy among infants and children ages 4 weeks to 6 years with diverse prior ART experience. The variable CD4 changes seen likely reflect multiple factors, including recovery, overlaid upon age-related normal changes. We believe our results support the recent FDA approval of this pediatric formulation of dolutegravir for the treatment of children living with HIV globally. The authors would like to acknowledge the entire P1093 protocol team, site staff, and most importantly, participants and their caregivers. We'd also like to acknowledge ViiV Healthcare, GSK for their team and financial support, and overall support from the NIAID and NICHD of the IMPAACT Trial Network. Thank you.